So my name is Brian Eustace. I work as a Strategic Operations Officer for Partners in Health. So I work on the operational components of clinical and non-clinical programs. I'm also the founder and executive director of BME Strategies. BME Strategies is a consulting company that works in emergency preparedness and response. We help local and state governments plan, exercise, train for emergencies. And I think there's broad strategies that organizations can adapt and use to manage an effective response for an emergency or a disaster. The realities of working internationally in such complex environments means that there's just so much specificity that needs to occur in your planning to make it sort of speak to the realities on the ground and the environments in which you work. I think really thinking through those thoughtfully and sort of exercising and training specific to the environment in which you're working in is just essential to having an effective response. The crisis communication plan is really about both communicating internally and externally. Internally to your own staff around risk and the types of response procedures and protocols that you need to put in place to make people within your organization safe and within your community safe. Externally to your partners to make sure that you're able to effectively communicate your activity outwardly to your partners and to your emergency stakeholders so that you can do a combined or organized response. One of the topics I discussed is sort of the backbone of many plans are around their incident command system or their way of managing the response, how they organize as a company around the response in which they're engaged in. There's many different types of management practices for responding to an emergency. Incident command system is one that you see in the United States frequently, that sort of there's a whole host of trainings and in-person and online trainings that revolve around teaching people for using the incident command system effectively to managing response. I think that it's really important to think about how policies and procedures, particularly around emergency preparedness, are communicated broadly to your staff in a really open and transparent way. I think that, people's safety is of utmost importance, and I think if policies and procedures are not fully disclosed or people are unaware, it only hurts your response. And often, in times of emergency crisis, there can be scarcity of resources and supplies, and to make sure that those are handled equitably and make sure that the way in which they're distributed is, and sort of Ben spoke about this, the way in which resources are distributed equitably is just essential. Otherwise, you can have an incredibly difficult situation.